Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled Serving Veterans, Service Members, and Their Families. And our presenters are Benjamin Pomerantz and Shannon McCall, both of the New York State Division of Veterans Services. They'll be joining us in just a moment. First, a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, and recovery services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, and recovery workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can also use the same mailbox to express an interest in providing a future Learning Thursdays program. And now, it's time to start the presentation and welcome our presenters.
So we just want to emphasize that we are not the federal VA, the U.S. Department of Veterans Affairs. That is a federal agency. Now, they are one of the agencies that we submit claims to in order for veterans to get access to their veterans benefits. But we are not them. We act outside as state advocates and agents for assisting veterans and their families with accessing the benefits that they earn for their time in service in the U.S. military. And so we can assist not only with federal benefits, but also with state veterans benefits as well, which there are a lot of, and we will discuss some of them later on in this discussion. So lots of people have an idea of who a veteran is, what that looks like to them, but there's really only one definition that we go by, and that's the one that you see on your screen, and that is a person who served in the active military, naval, or air service, and who is discharged or released, therefore under conditions other than dishonorable. And so anytime you hear us use the word veteran, that is what we are referring to in terms of how we are evaluating how we can assist a veteran. So we're going to go through a few examples of a veteran, and as we're doing so, if you can, I'd like you to think about whether you think this person is a veteran based off of what we're talking about. And we're going to discuss some of the ideas that you might have and why they might not be accurate, and why everyone that we talk about is going to be a unique situation that we can probably assist with. So in this first one, we talk about John, who is a Navy veteran and was injured during his time in basic training and received a medical discharge. And his entire term of service was only 6.5 weeks. Now, under the definition we just discussed, there is no length of service requirement for what makes a veteran under the federal definition. So John is a veteran. Even though he served 6.5 weeks, he signed up, he took his oath, he was in the active military, and was discharged under conditions other than dishonorable, and therefore is a veteran. And so we could assist them with accessing their federal, state, or local veterans benefits. So now we have Jane, and Jane is a commissioned officer corps in the Public Health Service, and she receives an honorable discharge from her time in the officer corps. Now, the Public Health Service is a part of the Uniformed Services, along with the Commissioned Officer Corps of the National Oceanic and Atmospheric Administration, also known as NOAA. And her time, she received an honorable discharge. So once again, the Uniformed Services is a part is the larger organization as opposed to the Armed Forces, which are the 5 branches of service. And so Jane is a veteran. She served under honorable conditions, and she did 5 years of service under the Public Health Service Corps, and therefore is able to access federal, state, and local veterans benefits. So now we have Richard, who served up in Plattsburgh, And at the end of his 4 years of service, he received an honorable discharge. He never went overseas during his entire term of service. And he still meets the definition of a veteran. You do not have to have been deployed overseas in order to be considered a veteran. Again, just like there is no time requirement to be a veteran, there is also no geographic location requirements in order to be a veteran. So he's served honorably in Plattsburgh for his entire term in the Air Force, and therefore is considered a veteran and able to access his benefits. So now we have Tia, who is a part of the New York Air National Guard, and she was mobilized under Operation Enduring Freedom. And during that deployment, she served for her 8 months and then came back home to her National Guard responsibilities. So this is a common case we see, and a lot of the times one of probably the more confusing ones because people think that they are not, for some reason, eligible. But because Tia was activated, she has active duty service and therefore meets the requirements as under the federal definition of a veteran, right? Her service, even though she resumed her National Guard service afterwards, that time still, that 8 month deployment still counts as active duty service and is able to access benefits as a result of it. Then we have Clarence, who was drafted into the Army and was deployed to Vietnam, and unfortunately was caught with narcotics and received a general under honorable conditions discharge from his commanding officer. So this one's a little different, but not as uncommon as people would think. So again, if we refer back to the definition of veteran that we first discussed, you'll notice that it said under conditions other than dishonorable. Clarence had a discharge status of general under honorable conditions. So for the purposes of the definition of veteran, he is considered a veteran. And are there some limitations to having a general under honorable conditions discharge? Yes, but Clarence still meets the definition of veteran. And there are benefits that he may not currently be entitled to, but depending on the situation, could possibly get access to them through various administrative processes like a discharge upgrade. And we'll go over what some of those benefits are in the next slide. So you'll see this one of two lists that we've got going on. And it talked about there are several different types of discharge statuses. So the ones you'll see up there are honorable, general, other than honorable, and bad conduct. We do not have dishonorable up there because under the federal definition, dishonorable is not considered, if someone has a dishonorable discharge status, they are not considered a veteran. However, that doesn't mean that if someone has a dishonorable discharge status that we cannot still assist them with possibly upgrading their discharge status. But we're just going to talk about these 4 discharge statuses for the moment. So you'll see under honorable for all the different types of federal benefits that you'll see. These are ones that come from the US VA, right? The Department of Veterans Affairs that most people know. That's everything from the GI Bill, service-connected disability compensation, VA pension, healthcare, death pension, or HUD-VASH. The answer is yes. As long as you meet each of those programs' requirements and you have an honorable discharge, you will be able to access them. Now, you'll go to the next column, which this is where our veteran that we just talked about, Clarence, would fall under, which is a general under honorable discharge. And you'll see that someone who has a general under honorable discharge can qualify for most federal benefits as long as they meet the eligibility criteria, except for the GI Bill. In order to qualify for the GI Bill, a veteran has to have an honorable discharge status. But everything else, service-connected disability compensation down, they can qualify for. And now we get into some of the other types of discharges. So the other than honorable discharge, you'll notice that there's sort of a caveat. It says yes with a COD. That's a character of discharge determination that the VA can make. And so what we're talking about is the federal government is the only one that can change a veteran's discharge status on their discharge papers or their DD-214. That's for the Board of Review to do for each branch of the military. However, for VA purposes, so that's for healthcare purposes, that's for National Cemetery Administration, or for benefits purposes, the VA can upgrade a veteran to honorable for VA purposes only. This doesn't change their official discharge status or anything like that, but it does open doors for a veteran to access benefits and healthcare, more importantly. And this is possible with a veteran who has an OTH or an other than honorable discharge. But you'll see that they still do not qualify for the GI Bill. But all the other benefits, it is possible, and so it is worth talking to that veteran about accessing services because they could get a character of discharge upgrade for VA purposes. And so the last one we'll talk about is the bad conduct discharge. So again, GI Bill, that's a no-go, but service-connected disability compensation, VA pension, and death pension, there is the possibility with a character of discharge upgrade for honorable for VA purposes that the veteran can access those benefits. However, they cannot get health care and they cannot access HUD-VASH. Generally, as a rule, these veterans could definitely benefit from having advocates who know these things and who reach out to them and say, there's a chance you could get access to benefits, because a lot of the times it can be really life-changing for them to access these funds and the other types of healthcare that could become available if there are upgrades. It's particularly important for OTHs and BCDs. Okay, so these are the state benefits that we're looking at here in discharge statuses. So again, for states veterans benefits, if you have an honorable discharge and you meet all the eligibility criteria, you're good to go. General, you meet, as long as you meet the eligibility criteria, you are able to access everything except for the state pension buyback on this list. So you can get access to state veterans homes, property tax exemptions, veterans tuition award, blind annuity, and extra credits on your civil service exams, but you cannot access the state pension buyback. And then for other than honorable discharges and bad conduct, no access to the state pension buyback or the state veterans homes. But again, the state will take into consideration if you have a character of discharge upgrade, which is honorable for VA purposes, you may be able to access your property tax exemptions, the veterans tuition award, blind annuity, or extra credits on the civil service exams. Again, a really important reason to reach out to our agency for assistance if you have a veteran who has those discharge statuses, because it really can be life-changing. I mean, the veterans tuition award alone could allow for a veteran to access education that they may not have been able to access before. So it's really important to keep that in mind and know that there are courses of action that can be taken to assist those veterans. All right, so I've sort of talked about this and touched on it throughout the entire time, but there's a reason everyone should be interested in this, right? Veterans will often say, I don't need that, give that to somebody who needs it more than me. I don't need those benefits. But the way that the system works is it benefits from the more people involved in it. The more veterans get involved in it, the more money and allocation and resources get put aside for other veterans who need assistance to access it. And so we really encourage, like, if you want to help out a buddy, you get enrolled in the VA, you access your benefits, and therefore more money can be allocated to assist your fellow veterans and their families. And again, what it comes down to is, you know, you can access tax-free money that comes in from the federal government that can help with a variety of things with your health care, with, you know, accessing different educational opportunities for you that you may need. You know, the service-connected disability compensation that comes in, it's all tax-free dollars that come in for a veteran and their family, and it really can be life-changing and often life-saving. The healthcare coverage, you know, the VA is the largest public hospital in the country, large public hospital system. Having access to that for service-connected disabilities is again, a great benefit, and depending on your percentage that you get, it can be for all of your health care. And again, the more people utilize it, the more money goes into it, the better it becomes. And the VA is responsible for tons of life-saving care that's gone on, and also innovative medical care that's occurred that we all benefit from. So it's a good system to be a part of. Of course, educational benefits, the GI Bill single-handedly helped build the middle class in America, and it continues to do so today. So it's a wonderful benefit to be able to access, and it's probably the one most people know about and use. But there's all these other ones that people should be accessing as soon as they can, and we can assist with doing that. And that includes everything from employment assistance to housing. You know, if you need vouchers to assist, there's things like HUD-VAS, which give priority to veterans to access housing, which we know can definitely be a struggle for many people. And for those who own their homes, you know, property tax exemptions, which can continue to go up depending on your service-connected disability rating. You can get larger and larger portions of it exempted. And that's, again, you know, money back into your pocket, and really an important thing for people, especially given current times. But mostly it's that you're going to have a group of people who are advocates for you, who understand your service, and who want to assist you. That's what our Veterans Benefits Advisors do. We train them on everything they could possibly need to know about how to be your best advocate and how to help you navigate the systems, because we know they're complicated, we know they're hard, but you earn these benefits and you should be accessing them. And so if you are a veteran or if you work with a veteran, we stress that we are here to help and to assist, and that everything we do is free and confidential, and that we've got your back. And with that, I'm going to turn it over to Benjamin to continue on about the work that we do.
Thank you very much, Shannon. That was terrific, as always. I was asked earlier by our co-hosts today, Dean and Paul Noonan, how long I planned on talking about veterans benefits, and I said, about 5 or 6 hours. Paul's heard me rattle on before. I don't think he was terribly surprised to hear that response. The 4 worst words you can give to a lawyer are, "The floor is yours." But I will endeavor to be brief as much as I can. We're going to talk about some of the specific veterans benefits that Shannon gave a great overview of, and talk about some of the basic criteria. And the most important thing to take away at the outset is this is not meant to be a learn everything and inscribe it on your minds kind of presentation. It's just know the basics, enough to have your spidey sense go off when you are working with a client who appears to be eligible for perhaps one or more of these benefits and services about which we are speaking today. And then you'll know, okay, this is a person who I should contact the State Division of Veterans Services about, and make certain they get connected with a Veterans Benefits Advisor who can provide that free advocacy and assistance on their behalf. Because exactly as Shannon just said to you, these are benefits that it is no exaggeration to say that they can change somebody's life in a positive manner. That's the work that all of you are doing every day. You're changing people's lives in a positive manner. And we look forward to being a component of your work, a component of your advocacy and of your assistance with your clients who have served in the military and their families, make certain that we help them and advocate for them along this veterans benefits pathway. So let's go to the next slide and start off by talking about disability compensation. This is the most common benefit with which we work. And the analogy you want to think about when we talk about disability compensation is the construction of a 3-legged stool, right? You have to have 3 sturdy legs for the stool to stand independently. First leg is obvious, military service. You got to serve in the military to qualify for the benefit. Secondly, a current disabling condition. You cannot get disability compensation for some condition that was in the past. And then third and most importantly, a nexus or a connection between that military service and this current disabling condition. You have to draw that correlation between the two. And what you have to show, what the actual burden of proof is, to use the fancy legal terminology, is not beyond a reasonable doubt. Okay, this is not Law and Order or anything like that, and it's not clear and convincing evidence. It's not a preponderance of the evidence. It's at least as likely as not. At least as likely as not. So if you're a baseball junkie like me, you know that in baseball, tie goes to the runner. In veterans services or veterans law, tie goes to the veteran. If you have equal evidence for granting the claim or against granting the claim, the case has to be resolved by law in favor of the veteran. So let's take a look on the next slide of how this looks in a hypothetical situation for a veteran. Here we have somebody who served in a flight operations team aboard an aircraft carrier. And she was on the flight line a long time, but guess what? The U.S. Navy never issued ear protection for her. And today, she has a difficult time understanding people when they speak in a normal tone of voice. And she also often has this ringing sensation or this buzzing sensation in her ears. So let's look at how we form a claim from that for disability compensation. Leg number one, military service. Yes, aboard that aircraft carrier in the Navy on the flight ops team. Okay. Next, current disabling condition. Yes, she has a difficult time understanding people speaking in a normal tone of voice. She has that ringing or buzzing sensation in her ears. So we're looking at hearing loss and we're looking at tinnitus. Now that brings us to one of the most common myths around disability compensation. Veterans often say, well, I don't think my disability is bad enough to get compensated from the federal government for it. And the answer to that, to the veteran, is that's not really your call. Let the federal government decide that for themselves, right? And our work is to serve as the advocates to explain to the federal government, to the U.S. Department of Veterans Affairs, this is what happened to this person in service, and this is why it has an adverse impact on their post-service life. So a lot of times veterans will think disability comp is just for a catastrophic disability, like the loss of a limb. And yes, it absolutely can be for that. But the most common claims that we file are claims for hearing loss and tinnitus, okay, and any other disabling condition you can imagine that could be linked to military service, right? Everything from migraine headaches to the whole palette of potential orthopedic injuries, you know, head, shoulders, knees, and toes kind of stuff. Any of that could be linked to service and have an adverse post-service effect on somebody's life, and therefore that should be compensated. So we have military service, leg one, the current disabling condition, leg two, leg three, the nexus between the two. Okay, well, she was on an aircraft carrier, on the flight line, around aircraft, loud noises from the aircraft's engines, okay, and the Navy never issued ear protection for her. So she was exposed in the Navy on board that aircraft carrier to extreme acoustic trauma over and over again, day after day, as those planes were taking off and landing on the carrier. And she never had ear protection issued to her. That's a good correlation to show that her hearing loss and her tinnitus was at least as likely as not due to that acoustic trauma that she experienced while in the military. So that should lead to a successful claim. And what does that mean? Well, it means that what the VA does then is they issue a disability compensation rating between 0% and 100% in increments of 10, with the idea of 0% being the least severe impact on the veteran's life and 100% being the most severe impact on the veteran's life. And sometimes veterans will say, well, okay, I got a 10% rating here for a disability, and that was 10 years ago. So, yeah, I've got my disability compensation. I'm good to go. Well, wait a second. 10 years ago, your condition may have been at the 10% level of severity, but has that condition gotten worse? Because if yes, chances are there'll be provisions in the federal regulations around that medical condition that shows if it got worse, an increased percentage rating and thus an increased level of compensation payout can be available. So just because someone got a disability compensation rating years ago, that does not set their rating in concrete. You absolutely can pursue a higher rating if that disability has gotten worse. So let's look specifically at the question of alcohol and or substance use in the disability compensation context. A lot of times people say that there is no compensation available from the U.S. Department of Veterans Affairs for alcohol or drug use, even if that alcohol or drug use did not begin until after their military service started. And the reason that myth exists and persists is because there is regulatory language from the VA saying that, in their estimation, alcohol or drug use is not by itself a disability for which compensation is available. It is, in fact, willful misconduct. That's the exact language they use, willful misconduct. Next slide, please. However, the analysis cannot end there because the regulations go on, and they say that alcohol or substance use can receive a disability compensation rating and can receive monetary payout from the VA as a condition secondary to another service-connected condition. So what do we mean by all that? What we mean is that you can play a game of connect the dots when it comes to disability compensation. And you connect the dots by showing that, okay, here's injury A that was directly caused by military service, and now here's injury B that was not caused in the military, but was a direct result from injury A. Classic example. You trip and fall during basic training. You injure your left knee, much like that example that Shannon had earlier in this presentation. So you injure your left knee badly. That's a direct service connection. You can get disability compensation for that left knee injury. Fine, that's easy. Now, time goes on. And as time goes on, you start to favor, you the veteran start to favor your right knee because your left knee hurts so much and is so unstable that when you walk, you shift your gait so that now you're putting more weight and pressure time and time again on the right knee. Well, guess what happens? Over time, that right knee is going to wear down. And all of a sudden now, you're getting pain, you're getting pressure, you're getting instability in the right knee. So you can receive disability compensation in that situation, not just for the left knee injury, but also for the right knee injury, because if but for the left knee injury that was caused in service, you never would have been putting more weight and pressure on the right knee and never would have caused that right knee injury to occur. So now let's take that concept and put it into the alcohol or substance use context. So if somebody is, for example, to use a colloquial term, self-medicating with alcohol and or drugs in an effort to cope with a mental health condition caused by military service, right? Anxiety, post-traumatic stress, depression, right? Name your condition, right? It could be caused by military service. That's your direct cause. And the use of alcohol and or the use of drugs as a way that that person is trying to cope with that condition and to dull the pain and anguish of that condition. Okay, let's connect those dots. The direct service connection is the mental health condition, right? The post-traumatic stress, the anxiety, the depression, whatever the condition is. And secondary to that is the use of the alcohol and or drugs as a coping mechanism, as a way to try and dull those symptoms. And you can connect the dots even one step beyond that. Next slide, please. So, for example, let's say you have a situation where the veteran is using alcohol in this self-medicating context to dull the symptoms of their service-connected post-traumatic stress, or PTSD. Now, that sustained alcohol use physiologically leads to cirrhosis of that veteran's liver. Well, okay, that veteran can likely receive additional compensation for the PTSD, first of all, because you can now show that connection between the service-connected PTSD and the onset or the increased use of alcohol and that self-medicating concept, as well as compensation for the cirrhosis of the liver, because you can say, if but for the veteran's increased alcohol use, the liver cirrhosis would not have occurred. And what was the reason why the alcohol use began or increased? Oh, it was because of the service-connected PTSD. So as long as you can keep connecting those dots all the way back to the beginning, you can have a secondary condition or even a tertiary condition, as long as it's emanating from that original condition that we're talking about here, then disability compensation can be available. Two last quick points on the disability compensation front. One is about something called presumptive conditions. What that means is the VA builds one leg of that three-legged stool for you. So, for example, let's say somebody served in Vietnam, in country in Vietnam, okay? They were likely exposed. They were presumed by the VA to have been exposed to a chemical known as Agent Orange that was used by the U.S. military as a defoliant. That chemical has been proven medically to have a number of different adverse medical impacts. And so what the VA says is that we presume that if you were boots on the ground in Vietnam on land, or if you were on board ships that were on the inland waterways in Vietnam, or within a certain area in the outer lying territorial seas around the Republic of Vietnam, and you have any one of, they give a whole list of conditions, we presume that that condition was linked to your military service in Vietnam, and therefore disability compensation becomes available. What's on that list? A lot of conditions that people do not often associate with their military service in Vietnam, like type 2 diabetes, like prostate cancer, like Parkinson's disease, okay, like peripheral neuropathy, which is that tingling or that painful sensation in the fingers or the toes, right, the extremities. These are conditions that people might not think about being linked to their military service from decades ago. And in fact, those become some of the easiest claims to win because the VA has that presumption. And there's other presumptions about certain conditions to people who were exposed to the toxic water that was at Camp Lejeune, the large Marine Corps base, or most of the trainees at some point marched through during their training process. There was toxic water there until the late 80s, and that led to a whole host of conditions ranging from adult leukemia to bladder cancer and all kinds of adverse impacts. There are presumptive conditions for people who were prisoners of war during their military service, people who were exposed to atomic radiation, and on and on and on. There's even one condition, unfortunately, it's Lou Gehrig's disease, ALS, that is presumed to be linked to military service regardless of when and where that veteran served. And those claims get fast-tracked by the VA for a faster decision and can lead to some compensation money coming into that veteran's life for themselves and for their family. And they can also lead, we're going to talk in a second about this, to survivor's benefits after that veteran passes away. So a lot of these conditions out there, people don't necessarily think as being, oh yeah, I injured myself in military service and it caused this or that. They kind of fall below the radar. And this is why the referrals to veterans benefits advisors who are doing this stuff day in and day out are so important, because they've seen all these cases. They have a strong sense of what the law is, what the regulations are, and they can advise that veteran accordingly and advocate on that veteran's behalf accordingly. Last thing on disability comp, myth number one at the top of the food chain that I hear all the time, I could probably retire at the age of 33 if I had a $20 bill each time I heard it. There is no limit on income, and there is no limit on number of years after discharge when it comes to applying for and receiving disability compensation benefits. You could be a multi-millionaire and still be able to receive disability compensation payments from the VA as long as you can prove that you have a condition that was at least as likely as not caused by or worsened by your military service. Your income, your personal assets have nothing to do with that determination whatsoever. And likewise, number of years out of service, it does not matter. I have personally won claims for people who have been out of service for as many as 70 years who have never filed a claim in their life, never. And they came in contact with me. We talked about their service. We realized there was a possible claim to be won. We sent that claim downrange to the VA with the proper evidence, and we won those cases. 70 years out of service. There is no time limit. Sometimes you get the barracks lawyers out there saying, oh, yeah, if you file more than 10 years after military service or 15 years or 5 years or 20 years, kind of pick a number, well, then you can't win. That is absolutely not true. There is no time limit for filing that initial claim. we'll wrap up disability compensation with one more note on the alcohol or substance use front, and that is the fact, just for your own use and your own background knowledge, the VA estimates that at least 20% of all veterans with PTSD also have a concurrent substance use disorder, okay? And Sam Schwaben estimates that only 50% of veterans in need of mental health care actually seek it. What does all that mean in terms of the work that we're talking about here? It means a couple of things. First of all, it means that if you're working with a veteran who is confronting alcohol or substance use, this is someone who potentially, not always, okay, not every single time, but potentially, and I would say even likely, has faced traumatic experiences in the course of their military service. This is someone for whom disability compensation financial payments could be available. This is someone for whom VA medical assistance could also be available. We'll talk a little bit more about that later on today, about what that medical assistance process looks like. And what this also tells us is that a lot of veterans who have experienced those in-service traumas and who really should be receiving mental health medical care as a way to learn how to cope with those traumas and their after effects and to figure out the best ways to go forward in their lives, half of those veterans are not actively going out and seeking that mental health care. And there's a whole galaxy of possible reasons why, and I won't go into the speculation now as to why this happens. But the thing is, these are individuals whom you can help guide in the direction of care from the federal VA at no cost or at low cost, depending on what the veteran's situation is, to that individual. And so for those veterans where there are financial barriers that could stand in their way of receiving that mental health care, these pathways to benefits, these pathways to services can be a tremendous asset in helping them overcome those barriers. So that's disability compensation in a nutshell. Next slide, please. This one, VA non-service connected pension. So disability compensation, I mentioned that income is not an issue, and the important thing is showing that you have a disability that was caused by or worsened by military service. So put that over in the disability compensation bucket. Now, VA pension, brand new category, brand new bucket. This one, income does matter. Net worth of personal assets does matter. And wartime service matters. You do not, however, have to show that the individual's disability was caused by or worsened by military service. They do have to have a disability, and it does have to be viewed by the VA as being a permanent and total disability. More on that in a second. But it does not have to be a disability caused by or worsened by military service for VA pension purposes. So what do you have to show? Active duty service during a wartime era. Okay, when we say active duty service in the VA pension context, we're talking about at least 24 months of service or the full period for which the enlistment contract stated if the active duty service occurred on or after September 7th, 1980. Anything prior than that, it's even less of a requirement. It's just 90 days active duty service. That checks the length of service box. Wartime era. This term throws people off all the time because it has the word war as part of the word wartime. And everyone thinks, okay, wartime service, that means service in the combat zone. If I didn't serve in a combat zone, therefore I cannot qualify for any benefit that has the term wartime in the criteria. And that absolutely is not the case. That is a myth. All wartime era means is you served somewhere in the world. Doesn't matter where. Continental U.S., Europe, Middle East, Asia, Australia, doesn't matter. During a time when the U.S. was deemed to be at war, and there is a provision of Title 38 of the U.S. Code that spells out the beginning date and the ending date for all these different wartime eras, including the present day. According to that provision of federal law, the Gulf War era began August 2nd of 1990 and continues through the end of hostilities. Well, those end of hostilities have not yet been announced. Therefore, any veteran who served anywhere in the world between August 2nd, 1990 and the present day is a wartime era veteran of the Gulf War era, okay? And just like, for example, the Vietnam era, you didn't have to go and be boots on the ground in Vietnam to be deemed a Vietnam era veteran. As long as you served somewhere in the world on active duty during the time period when the Vietnam War was taking place, that qualifies that person as a Vietnam era, a wartime era veteran. Same with the Korean War era, same with the World War II era, and so on. Permanent and total disability. This is always a fun one because it has an interesting wrinkle to it and one that often leads to me getting cross looks from people when I present this stuff in person. Because what the VA says is a permanent and total disability will be presumed under the following circumstances. If the person who is applying for the benefit is in a nursing home, if the person is receiving supplemental security income or SSI, if the person is receiving Social Security Disability or SSD, and everyone's favorite, if the person is age 65 or above, the person is presumed by the VA, by the federal government, to be permanently and totally disabled. Now, does that sound like ageism? Yes, it does, 100%. But you know what? When it comes to these benefits, it means we get to check that box right away for anybody who is age 65 or above with no further medical proof needed, and that is great. It makes the cases easier to win. It makes it better for the veterans, and so we take the win and move on. And then lastly, income and net worth. Every year, Congress sets a threshold for the income limits and the net worth limits for veterans applying for a non-service connected pension. And what they do, it's not going to be the same for every single person for two reasons. Reason number one, the veteran might be living alone or the veteran might have dependents in their household. The more dependents who live in the veteran's household, the higher the threshold becomes and the easier it becomes for that veteran to qualify for pension. Secondly, there's something called enhanced pension. And what that refers to is two different possibilities for extra payments in the pension context. One is called aid and attendance. One is called housebound. Housebound, as the name implies, refers to a veteran not being able to leave their home safely on a regular basis. Aid and attendance refers to that veteran needing assistance with two or more activities of daily living on a regular basis. Two or more activities of daily living. And there's one more trick with this income stuff, which gets into my favorite four-letter word, math. And we'll look at that on the next slide, because sometimes people who appear to be over income can, in fact, be able to qualify for the benefit anyway. If anyone's had any experience dealing with Medicaid spend downs, this is very much the same way. Because what you want to look at if someone seems to be over income for VA pension purposes are unreimbursed medical expenses. Unreimbursed, that means we're talking about a expense out of pocket for medical care of any kind that was not reimbursed back to the veteran by medical insurance or by any public assistance program. And here's where the math comes in. Because the VA couldn't just make it simple and say you take the unreimbursed expenses and subtract them from the income threshold set by Congress. No, that'd be too simple. What they do is they say, okay, you look at that person's maximum annual pension rate, which is the fancy name for the income threshold. You take that number, you multiply that number by 5%, and then you look at the unreimbursed medical expenses. Any amount in the unreimbursed expenses in excess of whatever number it is that is 5% of the max annual pension rate can then be subtracted out from that veteran's income, and the difference between those two numbers becomes the actual number about which the VA cares. So that's a lot of math and a lot of numbers, and it's probably clear as mud. So let's look at it in an actual hypothetical example. Next slide, please. So here we have Kareem, who has served for 3 years between 1950 and 1953. This puts Kareem as a wartime era veteran during the Korean War era. Now, Fort Dix and Fort Hood, those are both stateside bases. Doesn't matter. The fact that he served at those bases during the Korean War era qualifies him as a wartime era veteran. So we check that box. Does he meet the length of service box? Yes, he served for 3 years, well over the amount of time that's needed. He checks that box. We're good to go so far. Now, he suffered no injuries during his military service. So how can he meet the disability requirement for pension? Because there's nothing that happened in service that led to an injury. But let's look at his age here. He was serving in the military from 1950 to 1953. So that means this is somebody who likely is above the age of 65. That means he gets the benefits of that VA presumption that he is permanently and totally disabled. And so we check that box. So now we come all the way down to income. And he's receiving as his sole source of income a pension from his post-military job of $35,000 a year. He lives alone, okay, and what that means is we look at the part of the VA pension chart for somebody with no dependents. But now look at this. He hires a home health aide to help him with tasks like cooking and cleaning and medication management. These are things that go toward activities of daily living. So he's hiring somebody because he needs assistance with those tasks. What does that mean? That means he could qualify not just for pension, but for pension with aid and attendance because he needs help with 2 or more activities of daily living. Now we look on the chart, and I can read off the chart here because I have it on a piece of paper in front of me, and see that a veteran who qualifies for aid and attendance with no dependents in the household, the current 2020 income cap set by Congress is $22,939 per year. Uh-oh, that's a problem. Because Kareem is getting a pension from his post-military job of $35,000 a year. Uh-oh, he's over income. That's not good. Wait a second. He is spending $15,000 out of pocket every year in medical expenses. So now the fun begins. Now we get to do some math. Like I said, my favorite 4-letter word. So we know that the maximum annual pension rate, the MAPR, for Kareem as a veteran with no dependents who qualifies for aid and attendance is $22,939. So we take that number, we multiply it by 5%. 5% of that number is $1,147. So now we take that $1,147 and subtract it from his total out-of-pocket unreimbursed medical expenses. So $15,000 minus $1,147. That leaves us with $13,853 worth of unreimbursed medical expenses that we get to subtract. So we take the $35,000 a year income, we subtract $13,853 in unreimbursed medical expenses from it, and what does that leave us with? It leaves us with $21,147. What does that mean? That means now he falls below that threshold of $22,939, and therefore he's going to qualify for VA non-service connected pension. He checks all of those boxes. So just because the income on its face seems to be well above what the congressional threshold is, our analysis does not stop there. We get to go and look at the unreimbursed medical expenses, and if such expenses exist, we get to play that mathematical game and subtract it out to get to a result to see if the person does in fact qualify for VA pension. And in Kareem's case, he absolutely does. So that's pension in a nutshell. And now let's look at VA medical care. Next slide, please. Because this is probably the most common question that we get from veterans is, how do I qualify for health care? Especially these days when access to health care is needed more than ever before. And the nice thing is VA health care does have a multifaceted system. And it's substantial and it's multi-layered. You have the large hospitals, VA medical centers. You have smaller places, community-based outpatient clinics, often in more rural areas. You also have what are known as vet centers. And I want to emphasize vet centers because these are often places that get overlooked. They are smaller than the VA medical centers. They're smaller than many of the outpatient clinics, too. And they are specifically for combat veterans, survivors of military sexual trauma, and members of their immediate family. And the emphasis is on high-quality, confidential mental health assistance. These are mental health providers who focus their careers on serving the unique needs of veterans and their immediate families. And a lot of times there's criticism out there about, well, how do I find someone who's going to really understand me as a veteran? I mean, how is Dr. X or Dr. Y really going to understand what I went through when I was in the military serving this country? There's that concern about that military cultural competency gap. Vet centers exist as a means of helping to bridge that gap. And the services that they provide can be life-changing and they can be life-saving for the veterans and their families who utilize them. And the nice thing about vet centers is that when it comes to characterization of discharge, as long as you have a discharge that's above dishonorable, you can have a less than honorable discharge. And if you are a combat veteran or a military sexual trauma survivor or someone in their immediate family, the vet center remains open to you as a place to receive that mental health care, even though you have a characterization of discharge that is lower on the ladder than honorable. And then last but not least, state veterans homes. These are skilled nursing care facilities. There are 5 of them in New York State. They are high-quality skilled nursing care facilities run in collaboration between the state government and the federal government. What that means is a couple of things. First of all, it means that these are facilities limited to veterans, to their spouses, and to Gold Star parents, the parents of a child who unfortunately was killed in a combat theater. Secondly, what it means is that these homes tend to be a substantially lower out-of-pocket payment for a person utilizing that skilled nursing care than your general private sector nursing home is going to be. And thirdly, and extremely importantly, is we talked before about disability compensation rating, right? And the percentage rating the VA assigns depending on the severity of the service-connected condition or conditions. Well, if somebody has a disability compensation rating of 70% or higher, they get to receive that skilled nursing care from a state veterans home absolutely free of charge. No out-of-pocket cost. That goes for the veteran. That goes also for the veteran spouse. 70% or higher equals free skilled nursing care at any of these state veterans homes. So you think about the challenges that kind of long-term skilled nursing care can impose financially on someone's life and on their family's life. The ability to access that care at a lower cost, and sometimes if you're 70% or higher, you can do it at a no-cost rate. That's a game changer when it comes to someone's medical and financial existences. When it comes to VA healthcare, there's also some mythology out there about characterization of discharge. And the biggest myth is that somebody who has a less than honorable discharge cannot receive health care from the VA. That, thankfully, is not true. At one point in time, it was true, and laws have been amended at the federal level to make it no longer true, thankfully. So, right off the bat, if a veteran comes to the VA and they are in need of emergency mental health care, okay, as long as they have any kind of administrative discharge, even a discharge that is other than honorable conditions, the VA is required to provide them with at least 90 days of mental health care and longer if needed to address that mental health emergency. That's number one. Number two is something called the Federal Honor Our Commitment Act. And again, this focuses specifically on behavioral health care and mental health care. And the Honor Our Commitment Act refers specifically to veterans who served in combat or who served stateside operating drones or unmanned aerial devices, to use the military term, in a combat theater. You know, so they're stateside, but they're operating drones that are acting and committing acts in a combat theater, or someone who was a survivor of military sexual trauma. in any of those three situations, as long as that person has an OTH discharge or higher, okay, any level of administrative discharge, not just honorable, but any level of administrative discharge, the VA is required by federal law to provide that person with mental health care and behavioral health care, okay, not just for 90 days, but for as long as it's needed to complete successfully the clinically prescribed course of treatment. So again, we're talking in that situation about combat veterans, veterans operating drones, stateside but operate that drone in a combat theater, and military sexual trauma survivors. That's a situation where the Honor Our Commitment Act kicks into play, and any level of administrative discharge, doesn't matter, OTH is still fine, they get the mental health care and behavioral health care services that they need from the VA, not just for 90 days, but for as long as they need it. And last but not least, we have a thing called the VA Mission Act. This is a still fairly new federal law, which focuses on the ability of the VA to cover costs in certain situations for providing community-based care for a veteran. So outside of a VA facility, but still being covered by the VA. And that kicks in any one of a number of different situations. For example, a situation where the veteran is waiting to see, let's say, a medical specialist at a VA medical center, and it's a busy VA medical center, so the waiting list stretches on for months and months before even an initial consultation can become available. That's a situation where the VA Mission Act kicks in and allows that veteran to receive care at an approved community-based provider on the VA's approved network, and the VA covers those costs. Or let's say the situation when the veteran's living out in a rural area of the state, there is no VA medical facility for miles and miles and miles around, and the veteran needs to access medical care. That geographic distance from the nearest VA medical facility can lead to the VA's Mission Act coming into play and the VA paying for that care at a more localized facility, as opposed to making the veteran get into a vehicle and drive or take a train or some kind of transit option to the nearest facility. It also is supposed to kick in a situation where the highest level of treatment that's available in a certain clinical area is not available at any VA medical facility that's near where the veteran is living. So what that means in the context of our work together is that just because a veteran does not physically live near a VA medical facility, or just because the waiting list is long at a VA medical facility, or just because a VA medical facility near the veteran does not have the technology available to do a certain type of treatment that the veteran needs, that does not mean that the options are all off the table for the veteran to receive VA medical care. The VA Mission Act is supposed to kick in those situations and provide a pathway where the VA covers the costs, most if not all of the costs, for the veteran to receive that medically necessary care at the localized community level at an approved healthcare provider. So now we're going to move on to a couple of things in the New York State benefits spectrum. And we're going to look at a brand new law. It's so new the ink is still barely dry on it. It's called the Restoration of Honor Act. It became effective only a couple of days ago on November 12th. And this provides the restoration of state veterans benefits. So not federal disability compensation, not federal pension, none of that stuff, but New York State veterans benefits for veterans who received a general discharge or an OTH, other than honorable discharge, because of any of the following situations. Post-traumatic stress disorder manifesting itself in a certain way that their commanding officers either misunderstood or reacted badly to, and caused that person to receive that less than honorable discharge. Same thing with a traumatic brain injury. Same thing with the results of being a survivor of military sexual trauma. Or if that general or OTH discharge was the result of the military's policies at the time about that individual's gender identity or about that individual's sexual orientation. We know, for example, that old policies like don't ask, don't tell have been repealed by the federal government. This year is the 10-year anniversary of the repeal of that law. And so individuals who were wrongly discharged under those discriminatory laws of the past, we want to make certain that in New York State we have a pathway for them to be able to have their New York State benefits restored to them, and to also be able to have the proper recognition from state government to say, yes, we recognize the value of your service and we honor that service. So the Restoration of Honor Act, a favorable decision, restores eligibility for more than 50 New York State veterans benefits. The way it works is that applications, which are available on our agency's website, can be emailed with the accompanying evidence to the address on your screen here, inclusion@veterans.ny.gov. That's INCLUSION at veterans.ny.gov. Or you can mail applications to the Division of Veteran Services at 2 Empire State Plaza, floor 17, Albany, New York, zip code of 12223. When the applications are received, the applications then are reviewed and adjudicated by our agency's appellate units, and if the determination is a favorable one, then what happens is our agency will issue that veteran a letter on our letterhead saying, you have been reviewed and determined to have a favorable determination rendered on your behalf by the State Division of Veteran Services under the Restoration of Honor Act. What the veteran can do is take that letter on our letterhead and go to all the different state agencies that administer those 50-plus veterans benefits. And these range from extra points on civil service exams to parks passes for veterans who have a disability compensation rating of 40% or higher, to care at those state veterans' homes that we talked about before, being eligible for admittance to those homes, to everyone's favorite, the property tax exemptions. All those different offices have been trained to accept that letter verifying a favorable Restoration of Honor Act determination in lieu of that person's military discharge paperwork. Okay, we'll take that as proof of your service being honorable for the purposes of granting you this state benefits. So if you are working with a veteran and the characterization of discharge on their discharge paperwork is something less than honorable, chances are they have been told you don't qualify for anything. Chances are they've been told you are not even a real veteran, perhaps even by other veterans. That takes its toll. That really takes its toll. And the Restoration of Honor Act is one pathway you could perhaps put them on if they meet the criteria described earlier, because this can be a way to, number one, get them access to benefits, and number two, have the state government formally recognizing their service as being honorable. And that is a tremendous thing. We have had people who have received these determinations say, the benefits are nice, that's great, but what really is impactful to us is that letter saying New York State values my service as being honorable. And of course, as mentioned earlier by Shannon, the less than honorable discharge does not automatically bar someone at the federal level either. The vast majority of those federal benefits that are out there that could be on the table, from disability compensation to pension to HUD-VASH vouchers for housing to healthcare eligibility. There's a lot of different policies that could exist and a lot of different possibilities that could exist for that veteran to get access to federal, state, and local benefits, even with a less than honorable discharge. So don't let the veteran tell you to stop the referral process or the discussion process just because their characterization of discharge is something lower than honorable. Next slide, please. So we're going to wind up here by talking about some work that we have been doing recently. Shannon and I are co-leads of New York State's delegation to what's called the Governor's Challenge to prevent suicide among veterans and their families. And one of the things that we have done in this collaboration, and it's a collaboration that absolutely includes the Office of Addiction Services and Supports, because Paul Noonan has been a faithful member of this working group as well since the very first day it was formed. One of the things we did this year on Veterans Day is signed an agreement with the Columbia Lighthouse Project in New York City to provide training programs and to provide resources on something called the Columbia Protocol. All of our agency staff and to our colleagues and counterparts over at the county level of government as well. So what exactly are we talking about when we say the Columbia Protocol? This is a suicide risk assessment tool. It's a peer-reviewed tool. It's been proven to be successful with many different populations, including veterans. And the best part about it is it's simple, plain language questions. You don't need to have some kind of prior clinical expertise to know how to ask these questions or to know how to understand the answers. It's a conversation. It's a conversation that ordinary people can have with one another. And this is a way of getting these questions and integrating these questions into just regular dialogues. And, not making it any special or scary thing where it has to be a medical professional asking the questions, but it's just a regular conversation. And then the answers that come back in that conversation correlate to different scores in this Columbia scale. And the answers help the person who is asking the questions to identify, is somebody at risk of suicide? What is the severity and the immediacy of that risk? And what is the level of support that this person needs right now? And then the person can act accordingly or react accordingly, depending on what that Columbia scale score says. And it's just meant to take this whole conversation, this whole concept, out of being something that is seen as only a medical professional thing and integrating it into regular dialogue. What it does not do, very importantly does not do, is say everyone's a clinician. That's not what it says. It's not a matter of everyone can treat a mental health condition. That's not at all what it's going for. But what it is going for is everyone can and should play an active role in identifying if someone is at risk of suicide, assessing the severity and immediacy of that risk, and figuring out what the appropriate level of support is that this person needs at this time. Simply put, it can and does save lives, including the lives of veterans and their families. So as part of this collaboration with Columbia, one of the things that we are piloting is this idea of ask your fellow veteran service officer. And I want to conclude with this because it provides a message not just for veteran service officers, but for anybody, including all the listeners of today's webinar, who engage in the business of helping others, serving others, making your life and making your career around the objective of doing for others. Because often it is easy, and I am as guilty of this as anybody, to become so consumed with that important work of doing for others that we forget about ourselves, right? We forget about taking that extra step, taking that extra pause, taking that extra breath, and making certain that our own mental health and our own mental well-being is being properly addressed. Not just those whom we serve, but ourselves. That the age-old question is, who cares for the caregiver? And the answer sometimes has to be another caregiver, right? Making certain that we look out for the people who are around us, the people who are our colleagues, the people who engage with us in this mission of caring for others, and making certain that we are doing our due diligence to include things like the questions of the Columbia Protocol, to make certain that we're checking up, especially in times like these. We know the mental health toll that COVID-19 has had on everyone. No one's been immune to this. And so one of the things that we are piloting through this collaboration with Columbia is an initiative called an Ask Your Fellow Veteran Service Officer initiative, encouraging people who serve as veteran service officers, many of whom are veterans themselves, to just use these best practices, to use these protocols with one another, to check in on your fellow helper and see how they're doing. Do that buddy check. And I urge everyone listening to do the same. Certainly the folks over at the Columbia Lighthouse Project, Dr. Keita Franklin and Dr. Kelly Posner, they are approachable, they are accessible, they have great resources they can provide, and they often are able to provide those resources at low cost or even no cost if needed, because they want to get this protocol out there, they want it to be implemented, because it can and does save lives. So make certain that when you employ these best practices, not just with the people who you serve as clients, but also with one another. Make certain that you're looking out for that proverbial person on your left and on your right, and check in with them, especially during these times, and make certain that their own mental well-being, their own mental health is strong. And make sure, as best you can, to take that step back and ask that question of yourself as well. That's advice that I always have to remind myself of, and so I mention this now at the end of today's presentation as a reminder for all of you as well. With that, on the next slide, you will see all of the different ways to track us down and find us on all of our various media platforms here: Facebook, Instagram, Twitter, our mobile app, our New York State Veterans app, which is a free download for both Apple and Android devices, our website, veterans.ny.gov. And then on the next slide, you will see the contact information for both of us, for me and for Shannon. And please feel free to reach out to us if you have questions, if you want to know anything about the Veterans resources in your particular area of operations, or anything like that. Any way we can be of service to you, we are happy to do that.
I want to thank our presenters and the New York State Division of Veterans Services for today's program. I hope you will all find it useful while assisting clients in need of services. Your feedback is important to us. It helps us to know if we are meeting your educational goals and expectations. Once you have viewed the presentation in its entirety and completed the quiz, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation. Once again, thank you for joining us and keep up the good work.